am going to explain you Amoxicillin, a very commonly prescribed antibiotic. So, Amoxicillin is a broad spectrum antibiotic that belongs to the penicillin group of drugs. Okay, so it is specially the aminopenicillin is very commonly used in our daily lives. It is used to treat bacterial infection inside our body and various parts of our body. So the mechanism of action is amoxicillin works on inhibiting the cell wall of synthesis of cell wall of bacterial cell. As bacterial cell needs its cell wall to multiply and to regenerate it and to survive, the bacterial cell can't grow in our body. Thus, amoxicillin binds to protein called penicillin binding protein and prevents the formation of the cell wall. As a result, the bacterial cell wall becomes weak and leading to bacterial death. Therefore, amoxicillin is considered to bactericidal antibiotic and meaning it kills bacteria than just stopping their growth. Now, indications of amoxicillin is commonly used for respiratory tract infections such as sinusitis, tonsillitis and pneumonia, ear infection like otitis media, urinary tract infections, skin and soft tissue infections, dental infections. In combination therapy for Helicobacter pylori infections causing a peptic ulcer, we use amoxicillin. Now, pharmacokinetics, the route from which amoxicillin acts is usually the oral, that is capsule, tablets or syrup we use. Absorption is well absorbed from the gastrointestinal tract. Distribution widely distributed through body tissues and fluids. Metabolism is minimal metabolism. Excretion mainly excreted unchanged through the kidneys only. Because it is eliminated by the kidneys, dose adjustment may be needed to the patients with severe renal impairment. So the adverse effects are nausea and vomiting, diarrhea, abdominal discomfort, skin rashes. Serious but less common adverse effects include allergic reactions, anaphylaxis, severe skin reactions. Patients with a history of penicillin allergy should avoid amoxicillin at all unless advised by the doctors or physicians. Contraindications: amoxicillin is contraindicated in patients with hypersensitivity to penicillin. Individuals with previous severe allergic reactions to beta-lactam antibiotics. So why we are learning amoxicillin? Why us physiotherapists need to know about amoxicillin, this antibiotic? Because as a physiotherapist, you may encounter the patients taking amoxicillin for infections before or during the rehabilitation. It is important to be aware of possible side effects as gastrointestinal tract infections, upset and allergic reactions with the rehabilitation and antibiotic. Check medications history before the treatment. It is very important in the rehabilitation technique. Refer patients to a physician if they develop severe reactions such as breathing difficulty like shortness of breathing, widespread rashes or swelling. Okay, so thus amoxicillin is a broad spectrum antibiotic from the penicillin group which inhibits the cell growth of cell wall, of course the bacterial cell, and thus cell death happens, and it is widely used for respiratory, urinary, skin and dental infections, and it is mainly excreted by kidney. Thank you so much.